A further 113 people have died after contracting COVID.
There have been a further 32,700 new cases of coronavirus reported in the latest 24-hour period.
There have been a further 31,808 new cases of coronavirus reported in the latest 24-hour period.
Throughout the COVID pandemic, we've all been trying to follow the data.
Look, the UK line higher than anyone else, basically. Cases are rising very fast. Does that mean the vaccinations aren't working? Well, it comes down to the fact that vaccines potentially do two things.
From our specialist team here at Sky News to politicians making decisions for the rest of us.
Numbers that we are seeing at the moment are still a cause for concern. In the past 7 days, we've reported more new cases than at any previous time in the pandemic.
Shaped by the scientific advice they've received.
What we really need to do, all of us, is take things incredibly slowly. I would reiterate that now.
People across the country have been learning to live with COVID as we got our freedoms back.
I've been double vaccinated and I know that's a really selfish thing to say, but like I do want to have fun, but I am scared.
Yeah, it's good, it's nice, it's positive, you know, seeing people out.
But should we be worried about rising cases as the kids return to school? How much of a difference is the vaccination programme making when it comes to hospitalisations and deaths linked to the virus? And what might we be up against in the months ahead? Welcome to the Sky News Daily Podcast with me, Sarah Hewson, as we examine the story beyond the headline.
If you look at Scotland, you're definitely seeing cases rising very fast indeed.
In the studio with me for this deep dive into what the data is telling us is our economics and data editor, Ed Conway.
My name is Jeremy Brown. I'm Professor of Respiratory Infection. I work at University College London and also University College London Hospital, so a university post and a clinical post, and the clinical stuff is I work on respiratory wards.
And helping us explain the science behind all this as we wade through it, we're joined by a member of the Joint Committee on Vaccination and Immunisation. So let's talk numbers. Ed, where are we at in terms of the coronavirus data?
Well, I mean, the short answer is the cases are going up. I say it's a short answer because there's always some complexity here, and we're at a kind of, I think, a bit of a critical moment now because schools are about to go back. In most of the UK and Scotland, they've started to go back already. And the question of how much that's down to schools and how much that's down to the fact that cases were starting to rise a bit before that, well, we're still trying to pick through that. But it certainly looks like cases are rising. Remember, they went up a lot earlier on in the summer, then they came down, and that was the Delta effect, and then they started to come down. And the interesting and I think the significant thing about that moment where they did start to come down in kind of July through to August was that was really the first time that we'd seen cases start to go down that wasn't due to a lockdown. You know, it wasn't in the face of restrictions. It seemed to be that the vaccine programme was working. And so that was a really encouraging moment for the UK. But obviously now it's the end of summer and we're starting to see people being inside more. We're starting to see schools going back. You know, I think it's one of those moments where clearly we have yet to see the school effect, as it were. Mm. But it's not straightforwardly scary, I would say, the numbers. Not in the way that we've seen it before, but certainly they're on the way up, and that will give everyone, I think, a lot of pause for thought.
And Professor Jeremy Brown, how comfortable are you with where we are?
I guess, like a lot of people, we can't say we're comfortable because there's a high rates of infection, but we are reassured by the way that spike earlier in the summer did not translate into a massive spike of people coming into hospital. We've still got a reasonable number of people in hospital, and there's still people dying, unfortunately, of COVID-19. So it's that translation of the number of cases that occur in the community to how many end up in hospital, which is the key thing.
And that actually, if you look at the numbers of hospitalizations still really very low in comparison to where they were when cases were this high last time around in every single wave, and deaths as well. I mean, for a long time, there was a relationship between that line of when cases would go up, deaths would go up at the same kind of rate. Mm. And the good news that relationship seems to have broken down to a large extent. Deaths are still relatively high in comparison with where they were early in the summer. You're still talking about kind of around 100 deaths a day, but consider the fact that the last time cases were this high in the previous waves, you would be talking about maybe 500, 600, 700 deaths a day on the basis of those case numbers. So, in a way, that's the critical thing.
And Ed, when we talk about case numbers, how much more testing are we doing at this point than we were when we make comparisons to, for example, a year ago?
Well, actually, a little bit less testing. If you look back over the kind of the peak, as it were, do you remember all those be doing kind of hundreds of thousands
100,000 of tests a day?
Exactly.
Yeah.
So we got our testing up to very high levels around the spring. And actually, it's slightly lower now than it was before.
There's lots to pick up on there with you, Jeremy, then. In terms of the way we look at where we are and how we are doing with this pandemic, our case numbers, which we report daily, are they still a useful measure?
We're working towards a situation where we would ignore case numbers as a useful measure, essentially. Is that because if they don't translate directly into hospitalization and into deaths with this formula where it used to be a very clear cut, the cases go up, the hospitalizations go up, and then the deaths go up in sort of 2-weekly intervals. If that doesn't happen, then actually having COVID in the community at a mild level isn't that important. And that's where we're heading towards, and that's the logic of the vaccine, is to try and divorce the community-acquired infection rate from being an issue. So preventing that being the main metric that we need to look at, to hospitalizations being the main metric.
And in terms of the hospitalisations, what about the nature of those cases that do end up in hospital? The age, demographics, the length of time that somebody might stay in hospital, the severity of illness, for example?
In general, the age is a bit younger, and that's because of the vaccines has prevented older people coming into hospital, and there are more unvaccinated people in the younger age groups. It's also because the Delta variant is more effective at causing infection in younger people than the previous variants. The overall severity of the illness seems to be a bit less. Doesn't mean you can't get severely ill, but on average, the severity of people being in hospital seems to be a little bit less, and the death rate seems to be lower. But there aren't clear-cut data as yet.
Yeah, and it's an interesting point you said, when we're moving towards not looking at case numbers so much as we head towards autumn and winter. How far off are we from that, do you think?
I mean, see, those data are still useful from a sort of epidemiological and government planning point of view, because it gives us a feel for the overall levels of infection in the country and how many people will be immune because of infection and in combination with the vaccine. And because even though the proportion of people ending up in hospital who get infected is much lower than it used to be, it's still there. There's sort of proportion. So it's important for planning. I just think as a way of conceptually thinking about the disease, we need to think more about the consequences for severe disease. Essentially, this virus is going to be in the community, and it will infect almost everybody at some point. And if they've been vaccinated, then it will be a mild infection, or they won't get infected at all. If they haven't been vaccinated, then unfortunately, if they are at risk, then there is a risk of them ending up in hospital.
And of course, even if they don't end up in hospital, they could end up with long COVID.
Yes, and long COVID is an issue. Some of my colleagues run one of the most active long COVID clinics in the country, and they're seeing a lot of people, and there is a genuine issue with long COVID symptoms in a proportion of people who have been infected, even if it's only a minor infection.
But when we're talking about immunity, I mean, there've been a few studies in the last few weeks about the extent of kind of long-term immunity from previous infection versus vaccination. And it seems that immunity from previous infection is more effective, is it, than from vaccination?
So the whole thing about immunity is very complicated, because there are different ways of getting immunity, either a vaccine, and there's different vaccines, or exposure to the virus, or many people have had exposure to the virus then being vaccinated, or being vaccinated then had exposure to the virus. So it gets a little complicated. But the key thing here is that there's probably two levels of immunity we need to think about. One is immunity against getting infection at all, which is quite hard to achieve, requires 2 doses of the vaccine for the Delta variant to get high level of protection against infection. And even then, you get people who have been double vaccinated, and even fairly recently with good immune systems and good immune responses, are getting infection with COVID, but at a low level minor infection in the community. And then there's protection against severe disease, which is relatively easy to achieve and very effective even with one dose of the vaccine, and then with 2 doses against the Delta variant, it still maintains very high levels of protection. So it's really a bit of a complex area because you always have to break things down into those 2 types of immunity against mild infection and immunity against severe infection.
Yeah, still many questions. Coming up, what does this all mean for the months ahead? Jeremy, from what we know about where we are at the moment and what we've got to come as we head into autumn and winter, the pressures that's going to put on the NHS as we have schools going back, as we have students returning to university, moving around the country, what challenges does that pose for us?
Even though the translation of infection with COVID from mild disease to severe disease is broken to a certain extent by the vaccine program, we're still getting people coming into hospital, either because they haven't been vaccinated or because even the vaccine hasn't worked very well in them because of their age or their underlying immune conditions means that they have a poor vaccine response. So we do have people in hospital with COVID, and it's about 20% of the level of where we were in January of 2021. And that sounds quite a lot less than it was in January, but you just have to bear in mind in January, the situation was just horrendous and incredible, with the hospitals largely being COVID hospitals. So even 20% of that is a significant strain on the acute health services, and that has to be taken into account going forward.
It's not just beds as well and capacity, is it? It's the pressure on NHS staff who, as we know, are exhausted.
Yes, I mean, it's been going on for a while at a high level of intensity, and that causes exhaustion. Yeah, we're in summer, which is the what you might call the fallow period, if there's of the NHS activity. Although it's not really a fallow period, it's just less active. And winter clearly is a busy period. And last winter we were partly protected by the fact that the normal viruses, the flu and the RSV viruses, which are common respiratory viruses that cause problems in many people during winter, they were not circulating because the lockdown prevented them as well. This winter, there's no lockdown, so there will be those respiratory viruses and other respiratory infections occurring, and they will increase the number of people coming into hospital on an already stretched system.
How much, Ed, of the winter strains are already factored into the modelling on data?
It's very difficult at the moment. That's the problem, is that we don't yet know how long-lasting this probable initial spike that we're going to get in infections in schools is going to be. You know, it could be quite a short-lived thing, just like we saw in the summer when Delta kind of first arrived and we saw cases spiking up and then they actually kind of went down of their own accord. You know, it could be quite short-lived, and if it's not, then that could be a more severe issue. Last year, cases were at this stage in autumn were really very low, and so were hospitalisations, a lot lower than they are now. And there's a kind of straightforward reason with the numbers where if you're talking about an exponential rise, if it's happening from a very low base, then that's one thing. But if it's happening from a base where you've already got hospitalisations, you know, which are kind of relatively high, which they are at the moment, you know, you're talking about kind of in England admissions kind of around 800 or so, which is higher than it was in July. If you're starting from that base and you're starting to rise, then that's the concern. So you're starting from a very high base already. As I've said, and as Jeremy has said, those old relationships seem to have broken down
because of the vaccination.
Because of the vaccination. Yeah. Because I suppose as well, it's probable that, you know, you've got higher degrees of immunity through infection as well. The combination of vaccination mostly and also infection as well means, you know, a lot of people have talked about herd immunity. It's one of those phrases that's got a bit of a bad name, but certainly we're edging closer to whatever you want to call it, whether you call it herd immunity.
Yeah, Jeremy, is herd immunity ever something that we can look to achieving? Do we want to achieve that? Is it possible?
We're sort of edging, I think, as Ed indicated, towards a situation where it's going to be hard for the virus to spread through the community because either people are immune because of vaccination or because they've had the infection before. And that in itself will lead to a tailing off of the infection.
Which is a positive note at last. And in terms of younger people, as we're recording the podcast, decision on 12 to 15-year-old vaccination hasn't yet been announced. We have started the vaccination of 16 and 17-year-olds. We saw festivals that were offering pop-up vaccination sites. How much of a difference is vaccinating that bracket going to make, Jeremy? And what about take-up of the vaccine in that younger age bracket?
We would expect the take-up to be high in people who are very worried about the virus. And it's quite clear that if you're over 70 or you have a severe underlying disease, your risk of dying of COVID is high. And those populations have been very keen on the vaccine in general, and about 95% of them have taken the vaccine. We prefer it if it's 100% or as close to 100% as possible, because if you don't take the vaccine and you're at risk, then with this Delta variant circulating, the chance of ending up in hospital or in intensive care is pretty significant. So it's sort of natural that if you're somebody who's in his 20s and you look at the data and you think, well, actually, the chance of getting a problem with COVID is relatively low for me, then your incentive to get the vaccine is not so high. And it doesn't mean you're not going to get the vaccine. It's just you're not going to run out and get the vaccine as soon as you can. It becomes less of a high priority for you.
Well, I mean, all told, are you surprised at this at the kind of the success and the take up of the scheme? I remember kind of early on in this vaccine program, a lot of people were saying, well, it's going to be very difficult to persuade people to get it. It's as you're saying, for certain age groups, it's extraordinarily high percentages.
So the take up across adults in total is higher now. I'm just talking about the really young, the younger age groups,
where the risk to benefit ratios are not so high.
Yes, and I think what happened in France is sort of informative here, where they suddenly said you can't go to a restaurant unless you've been vaccinated, and lo and behold, within a few weeks, the vaccination rate in the young people has gone up quite a lot.
And that's something the government's been toying with here, hasn't it? The carrot and stick approach. But at the moment, it is a matter of choice.
People are aware that there are social restrictions if you're unvaccinated. It makes life harder for you if you want to do things. And I think that's fair enough, because if you're unvaccinated, you are a potential risk to other people. And it may be a personal decision, but the consequences are not just for yourself, they are for others.
Well, is your risk to other people unless you've had COVID already, in which case you might well be less of a risk than someone who's been vaccinated. Is that fair?
Maybe, maybe not. I think it's hard to know whether the one episode of infection is generally considered to be similar to one vaccination. To get the best level of protection, you need at least two.
Ed, just a final thought from you in terms of the data, what you're going to be looking out for over the next couple of months. And Nicola Sturgeon has in Scotland raised the prospect of some restrictions having to come back in. We don't obviously know to what extent that might have to be. With your economic hat on, the importance of not having to put restrictions back in place.
In terms of the first bit, which is what data we're going to look at, definitely more hospitalisations this time around than cases, and that's going to be the key thing to keep an eye on, and obviously deaths as well. And hopefully those numbers will remain much lower than they were in the last few instances. So far, fingers tentatively crossed on that. At the moment, we're going to very soon see the end of the furlough scheme, and there has been an enormous effort, kind of fiscally, to support the country. Millions of people have been supported by this scheme, and that is about to come to an end. So the idea of further restrictions, just as that's coming to an end, is pretty terrifying for many households and businesses around the country. The economy is recovering, but we're still short of where we were before COVID-19 struck. That represents a big dent. From that perspective, I think this winter, in a weird way, the country economically has been anaesthetised to a lot of the pain because of the furlough scheme. And we just don't really know until that is lifted what the real true state of the employment market, of the labour market, is going to look like. And on top of that, you've got all sorts of other things happening, like, we're still absorbing the impact of Brexit. And put those things together and you start to see implications. I mean, you've seen labour shortages, for instance, with truck drivers recently. We may well get more things like that in the future. And on top of all of this, you have global shortages of various different things like semiconductors and building materials and stuff. economically, kind of actually, as things have been relatively quiet, but they've been quiet, I think, because of things like the furlough scheme. And the moment that comes to an end, I think we start to get a sense of just what the damage has been and how easily we can bounce back. In July, when numbers started to come down, they didn't come down because of restrictions. I mean, clearly it was school holidays coming in there. And so we know now it is possible. We've seen light at the end of the tunnel. It's possible for COVID to come under control without having to impose a lockdown. But it's going to be a nervy period for everyone, I think.
And Jeremy, what about you? Do you see some light at the end of the tunnel?
Yes, it's been a very long tunnel. It's been longer than I expected it would be. And these variants have really been a problem. I mean, the Delta variant can't be underestimated how much of an issue that has been because of its much greater infectivity and also its increased ability to cause severe disease. Going forward, what we need to look at are the numbers of people being infected in the older age groups. So mostly at the moment, it's in the younger age groups. If that shifts and we're getting infections in the older age groups.
So if we start to see the vaccination protection waning, for example.
Yeah, that would worry us. And then obviously the hospitalisation rate is key here.
And on vaccination protection and the potential for it waning, we do have the data from Israel on that. What about the plans for booster vaccines?
We're sort of trying to predict the future without having the clear data to do that. But what's happened in Israel is that infections have occurred in people who've been double vaccinated, and probably in those whose immune system is impaired because of their underlying disease or the medicines they'd have to take for those diseases, and in those who are elderly, where the immune system is poorer anyway, doesn't work as well, then there might be a waning of immunity over time. And that will need to be factored in when we discuss booster jabs and make our decisions on those.
That's it until next time. My thanks to Professor Brown, Ed Conway, and to you for listening to the Sky News Daily Podcast, presented by me, Sarah Hewson. This edition was produced by Annie Joyce and Emma Ray Woodhouse, along with Tatiana Olsen and Simon Windsor. For the latest on everything that's happening with COVID, head to Sky News and our mobile app. If you've enjoyed this podcast, we've plenty more like it where you found this one, and we'd love a review while you're there.
The climate crisis can be an overwhelming and emotional conversation.
We will not let you get away with this.
But it isn't just about cutting carbon emissions or reporting on disasters. On Sky News Climatecast, we'll examine the big issues in depth with scientists, policymakers and activists. Every week, we'll highlight how small changes can make a big difference as we look for solutions to climate change problems. Sky News Climatecast. Listen, follow, subscribe.